Welcome to CareTalk, your virtual home for insightful debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Hey, John, we've got a guest on the show today. Who do we have?
Well, we've got a real heavy. General Stanley McChrystal, retired four-star general officer with a very distinguished military career, who leads a decade-old firm, the McChrystal Group, that's one of the leading leadership consulting and strategy consulting firms for large and small companies. He's published 3 popular books, and I think we're going to hear a little bit about some of the insights on leadership, particularly leading at a time of Corona. And then we got a bunch of questions for him, so I'm excited about this. Welcome, Stan.
Thanks for having me.
Sounds good. Well, here's the first question. So you've been a longstanding advocate of a national service program, which makes me wonder, would it have played a constructive role during this current COVID-19 outbreak?
Well, thanks for asking, David. And the short answer is yes. And here's sort of why. I believe that national service, the opportunity to do a year of service to others in our society, not just in military service, but healthcare, education, conservation, you name it, gives young people the opportunity to be part of something big, to learn a little bit of discipline, sometimes to learn a skill, and to have a sense of contribution. And when you feel like you've contributed to something, you feel like a full-fledged member of it, like you feel like you've done something for the nation. The next time you vote, you feel like, hey, I not only have the responsibility to vote, I should be voting because I'm one of the people who built this. At the same time, I think that what it does is it creates also an opportunity in a crisis like this to leverage those young people who are doing that service, because they can be doing important things all the time, but in a crisis like this, they step up and they take a place in something that really matters, that will be the memory of their lifetimes. The reality is most people of this generation will refer to before and after COVID-19. And what they did during COVID-19 can be a source of pride, and it can be a source of a sense we can all be better together. And that's one of the things I think we can do for that generation, and also welcome them into a larger sense of American citizenship.
It's interesting. We've been thinking about this, and I'll just pick on John, because we've been thinking about how do you train a healthcare group and how do you deal with unemployment. And John's actually proposed, along with Toby Cosgrove, kind of a health corps that kind of ties into national service as well. Maybe those go together.
I think they do. If you think about it, in wartime, we bring people in and train them to be soldiers, but we don't need them to be soldiers when the war's over. And so they go back to life. We're fighting a war against COVID-19 right now, and we're likely to fight a lot more health challenges, just as we have an aging population in America. So training people in healthcare would be something that, one, give them an opportunity to contribute during times like this, but also a useful skill for either employment or avocation later in life.
As you look at what's going on with COVID-19, are there any aspects of this pandemic, either in challenge or the way we're responding to it, that remind you in any way of the enemies you were up against, and with a great team of coalition partners and soldiers? Is there any parallels there that you'd want to draw? Any lessons you learned from those experiences?
Certainly. And I'd start by describing Al-Qaeda in Iraq was the one that was most notable. And they had the name of Al-Qaeda, but they were an entirely new organization that emerged in Iraq starting 2003. And they were very different from their namesake. They were viral, they were amorphous, they were adapting constantly, they were lethal, and they felt like they were everywhere, which feels a heck of a lot like COVID-19 does. The idea that you've got this threat that comes at you that you're not quite sure what to do about, and it's opportunistic in nature. So wherever there's a gap or a seam, that's where it seems to go. Wherever you let your guard down, you are punished for. So what we found to fight against Al-Qaeda in Iraq is, instead of being our traditional model, which was fairly industrial age in structure, we went up the chain of command, down the chain of command, gave orders, and we operated at the speed that physics would allow that kind of a structure to operate. We had to change to being entirely distributed. We took our command and put it across 76 different bases across 27 countries, and yet we had to synchronize that fight every 24 hours because that was the nature of it. And so We learned that operating distributed had new dynamics. We were fortunate that information technology was coming of age in 2003, but we had to leverage every bit of it so that we could operate fast enough so that we could actually get faster than our enemy, Al Qaeda, in Iraq. And I think COVID-19 is a similar challenge. We are, by definition of the threat, we have to operate distributed, work from home, and social distancing. But we can't not be as effective as we would be if we all came into big conference rooms and we sorted out the problem like we traditionally would. So now we've got to be able to bring efforts together, bring minds, bring talent to make things happen in this new model. I think we're learning our way through it, but I think we're going to get much better as every day passes.
Can you relate that to, I've heard these discussions and people calling for someone to be in charge, a kind of a czar, if you will, to oversee the COVID response, either at the federal level, at the state level? Does that make sense? That for one thing, I get a little concerned because it sounds like we want to bring a sort of a Russian ruler in to work with us. But if we get beyond that, does it make sense to have that kind of strong top-down command?
No, I think that it actually would be a good idea. I don't like the idea czar because, that term does have sort of a negative side. But the reality is, I used to describe this in the war on terror. When we declared we were going to fight the war on terror, I used to ask people, who's in charge? And they'd say, well, President Bush. And I'd say, well, okay, that's right. Who below him? And the answer was nobody. Because although the United States government is set up to have cooperation across the different parts of government, in reality, nobody below the president has tasking authority. And so everything else is sort of handshake and agreement. And the president is busy doing other stuff. So in an effort like this, I actually believe unity of effort could be best attained by having somebody who has the equivalent of unity of command. Now, clearly they work for the president, they answer to Congress and whatnot. But if somebody doesn't have the ability to direct the use of resources, where resources are going to go, if someone doesn't have the authority to make tough decisions between this or that in terms of priorities, almost triaging our ability as a nation, you're going to be a lot less effective than you need to be. Now, this runs against the grain for a lot of people because a lot of agencies and leaders don't want to give up any sovereignty. But this is important enough. We need to have, I believe, clearer responsibility, accountability, and I think you got to give somebody authority to do that.
And as you think about, you're a student of history, you've written some great books on leadership. As you think about different presidents' responses to different crises, I think of this as World War C. And you look at DJT, the current President Trump, and compare him to FDR, let's say during the Second World War, where he emerged as a great leader. Are there contrasts you'd want to draw or lessons you'd want to draw from FDR to either to contrast with the president and things that we should be learning from today based on leadership in World War II versus leadership right now in an era of Corona?
Yeah, absolutely. I'd start with Franklin Delano Roosevelt back when he was elected in the fall of 1932. The Depression was really just starting to settle into its lowest point, its most difficult point. He's inaugurated at the beginning of 1933, and he had run on a balanced budget platform. But he got in, and it became clear that that was not the right solution for where we were at that point. So he came in and he told people, this is going to be hard. So he first didn't tell anyone it was going to be easier than it was. He said, we, however, are going to get through it. And I don't know how we're going to get through it, but we're going to try a whole bunch of things. Some won't work, and we'll just keep trying till we figure it out. So he gave people the short-term idea, okay, we're going to take action. He gave them the long-term confidence that we are going to get through it. And he signaled commitment that I will lead this process. Now, he got a lot of resistance. Sometimes people forget that the New Deal had a lot of internal politics fighting back and forth. But he weathered that. And then when we got on the eve of World War II, on December 6, 1941, American public opinion was still against us entering the Second World War. Yet Franklin Roosevelt, seeing it as inevitable and necessary to protect, the existence of the free world, he had been pushing the nation, or really leading the nation, towards the requirement that we had to support the Allies, we had to do Lend-Lease, we had to keep Britain alive. We had to do a number of things that were not particularly popular with the American people, but he felt were essential. And so he postured himself by building that level of consensus. He brought the American people along with him. Then when it was time to prosecute the war, he could be the kind of leader that he needed to be, because suddenly American public opinion, of course, with Pearl Harbor, switches over. It's about leadership in the end. It's about communicating honestly with the American people. It's about listening to the American people. It's about giving them both hope, inspiration, and sometimes goals for them to try to meet that are higher than we want in the moment.
Well, that's it for another edition of CareTalk. We have a special edition this time with retired General Stanley McChrystal. We've been talking about leadership in the age of COVID-19. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. And thanks so much, Stan, for giving us some insights, historical and contemporary. I think if leadership lessons couldn't be more relevant than right now.
Entirely my honor. Appreciate it.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.